Hello, and welcome to the Holistic Nurse Academy podcast. I'm Holly Taylor, a board certified holistic nurse, and I've been a registered nurse for 15 years. Today, we have a fun guest. We're changing things a little bit today with Tammy Ward Anderson, and we are exploring the space between conventional healthcare and the wider world of energy healing, not as competing systems, but as different perspectives on what people may need in order to feel whole. So, my guest, Tammy, is the creator and producer of the Energy Healing Conferences, which have been around for at least 10 years. Is that right, Tammy? 10 years?
We're actually going into our 13th year. And,
Yeah, wow.
and my name's Tammy Anderson Ward. Not that it matters too much.
Oh, sorry. Did I say Tammy Ward Anderson?
Yeah, no, you're totally good.
Okay. Um, and you are one of the practitioners, you're an educator, you're a business owner, and these are all the people that you attract to your energy healing conferences. So we just wanted to talk a little bit today about what you've learned from that community, what you're learning, with all your expertise and experience, and then why you feel like people are increasingly seeking this type of healing modality or these conferences because they are very well attended and people are very excited to learn when they show up. And so I think it's an interesting insight that you can provide as to why.
Awesome.
Um, yeah, so we can cover a lot today. We'll see where the wind takes us, so to speak.
Yeah, sounds good.
um, but what do you want us to know about you first and foremost?
Well, I definitely am really grateful of how you did the introduction, how you said they're not competing systems, because I've never looked at it that way at all. My
Hmm.
perspective comes from one of great respect for the nursing world in general. My grandmother, my mother's mother, was a nurse for 40 years. That's a long time, right?
Yeah. Oh my gosh. Yeah.
And my mom was her only daughter out of 8 kids. So I'm like she's like she and I were really close, even though we lived in different states. And
Yeah.
so I like learned what I learned from her. And actually, my mother went into nursing school. She didn't actually end up graduating. She decided to go a different direction. But the fact is, like, I know how much I hold it with great reverence and
Mhm.
respect. So I wanted to start out with saying that because I don't want people thinking like, oh, who does she think she is? Kind of a,
Right.
because I'm like the offspring of a nurse. Do you know what I mean?
Right. Well,
So
and I know that about you, so I'm glad you brought it up because yeah, you and I have talked outside of the conference and outside of this podcast, and I do know that you have a lot of respect for that. So
yeah,
mm,
absolutely. For sure. And the other thing is like I had a recent experience with my dad in the hospital. So I was there with him for a couple of weeks and I did witness there is a pretty stark contrast between the nurses who are feeling burned out. They look like they're burned out. They're literally just like doing everything so half-assed, you know what I mean? And then there's
mhm.
that you can tell they just really, really care. They're all the time. They're so supportive. I didn't have to advocate once for my dad in any of those situations. And so because I have this great respect and reverence for nursing, I wanted to come on this podcast to be able to offer my support in any way, shape, or form. Um, Especially to just be able to help people maybe even last longer and not have that burnout. You know what I mean? To be able to enjoy it even more. I'm not coming from a perspective of like, I know more than you, because I don't. I just, I know what it feels like to be burned out. I have 8 children. I've been producing these large conferences for 13 years. I also homeschooled my children for about 15-year period. And so I know burnout really well. And so now I learned how to help engage people in preventing that and then
Yeah.
also coming back from it as well. So yeah, I wanted to kind of start with that if that's okay.
Well, I was going to say, you could teach us all something because you're a mom of how many again? Eight?
8.
Eight.
I know
I
it's
was like, and I remember like I was going to one of your conferences and I had questions for you. And I know you have like a gazillion people asking you questions, text messaging you. And everything, you were just always so calm every time you responded. I was like, I need some of that Zen in my life. You could teach us all something about that. Um, but anyway, that's meant to be a compliment to your
Yeah, no,
ability to be Zen and calm.
I definitely
So
I
you
have
have this
this.
you have this background with your grandma being a nurse, which influenced a lot of how you see the healthcare world. So what's kind of your journey to where you're at today? Do you want to walk us through that? Like
Yeah.
your own personal journey to what led you into, I would assume most of us start um, getting into these modalities because we're going through something. Is that true for you?
Well, I just kept having reoccurring situations happen over and over with my kids. Like
Mm,
my oldest was having earache after earache. I think we did about 17 rounds of antibiotic in her first 4 months before the doctor suggested doing tubes. Um,
okay.
so I learned a few things from that because ended up happening, as sometimes does, if you have that many antibiotics, even one round of antibiotics can give you a yeast infection or other types of side effects, right?
Right.
We definitely learned how to kind of deal with all of that at the beginning. Now, fast forward to all the way up to now I have 6 kids, and this one child, he had a pretty serious situation, and I knew what they wanted to do with mainstream because we had taken him in and gotten some, important information, but I just didn't feel right about it. And I know that that's like, oh, really, you didn't feel right about it. But all I know now is that like a mother's intuition, it was just telling me like, hey, there's more to this. Look around kind of thing. So it wasn't a no. It wasn't like a shutting of the door. It was like more like, hey, I just need to learn more before I decide this. And I ended up going to an iridologist who looked in my son's eye. And it's the study of the iris, right? It's like a map inside of your body that is meant to give us messages. And so this iridologist looked in my son's eye, knew what was going on immediately, which I was like, how would you know that? Like, there's no way that you would know that, right?
Yeah, yeah,
And she referred me to this other person.
yeah.
So this iridologist referred me to another person, and I'm really grateful that she didn't say this is an energy healer because at the time I was in such a box that I wouldn't
Oh, yeah.
have gone. And people now they hear that they're like, that seems really like, what do you mean? I'm like, I wouldn't have gone. I just wouldn't have gone. I'm grateful I did go because she, in one session, cleared the entire situation. And that particular health predicament that we were finding ourselves in for that particular child went away in just one session, like was gone. And it was non-invasive. It was like it didn't hurt him. It was like he was sitting across the room from her. She knew things that I had not shared with her. It was my very first interaction with her ever. I was really blown away. And I went home and I was like, okay, why did that happen? How did that happen? I need to do more. And I kind of just like fell down that rabbit hole, I guess you could say.
Yeah.
That's how people
Mm,
describe, like, I went on a deep dive, and everything that I found online either scared the crap out of me, because it was just there's so much misinformation, or it intrigued me. And I was like, I need to know the truth about this stuff. I feel like it's really important. And some things call out to your soul and some things don't. But this one just it's like I couldn't shake it. And so
mm,
I started doing my own trainings. Like I followed and started participating in workshops and classes because I wanted to learn how it worked. I'm not going to just like settle for it worked and then done and move on with my life. Like I need to know the science behind it.
mm.
So I did. I dove in both feet, and I'm really grateful for what I learned because it set a different type of trajectory for my life. It just opened up my mind. And so people describe me as like an energy interpreter is what I've been described as. I think it's an easier way of saying it is just like I want to know all of the different angles of how to see it. I just want to be able to see the science of it from this type of department, and then I want to go see it from this type of department, how they look at it differently.
Sure.
And so, and so that's kind of what started my journey of doing
Okay.
energy healing conferences, because I want to say it was 2012 when I started my very first courses, and then 2013 when I started graduating, and we did the very first energy healing conference in 2014. And we had 1,400 people from literally all over the country, and plus three other countries attend that very first one. And I really like, people were like, where did all these people come from? And I'm like, I guess this is just really like important. And so right from the beginning, we've had huge interest, and how it's evolved over the years, it's changed a little bit because I've brought in a lot more scientists and researchers and healthcare providers that also utilize these modalities as part of what they do to help people heal in lots of different forms, right? But do you have any questions on that? I feel like I'm just rambling.
Oh, no. No, it's all very interesting. Keep going.
So yeah, that's one of the ways that it's evolved. But I also wanted it to be not like where you go to a conference and you really don't have a lot of options. You just kind of have to sit there with one thing.
Yeah.
So that's one of the reasons why I like to break it up into, it's like a whole day of breakout sessions, because
Yeah.
I want people to be able to go to where their interests are. There could be three or four or five different classes all at once, and there's like two or three that you really have an interest in. So maybe you divide and conquer by having a few friends come, and they go to the classes, right? And then you come back together and talk about what you learned and what you experienced. And there's also different activities that you can participate in: meditation, breath work, sound healing, all of these different types of things, yoga. There's going to be things that you can try, not just have a lecture and
Right.
learn about it. And
Right.
then, of course, we have the vendor area, because I also want people to be able to have their own experience so they can try out different modalities, even things like Reiki. There's a lot of nurses now that are learning things like Reiki or cranial sacral therapy. I mean, the list goes on and on of different modalities that a lot of nurses are now opening up their mind to.
Right.
So, I mean, you know firsthand that, because I think, aren't you trained and certified in a few of those yourself?
Yeah. Both of those. Yep.
Yeah.
Yeah. Yes. It's been a deep dive situation for me too. And for different reasons, but kind of that same thing when the person called it cranial sacral therapy, but there was more to it. I think that was their, like how I do it. That's my primary modality, but then you usually know more modalities underneath that.
Mm-hmm.
But I had that same experience for myself that you had with your son, where it was like, okay, what is this and how do I learn it? Because it changed the trajectory of my healing process, and as we kind of evaluate the type of people that show up at these conferences. I've been thinking about this, percolating, knowing that we were going to talk. And one of the things I was thinking is, what are they seeking? Are they seeking community? Are they seeking some answers? Or, which I was kind of like, we talk about mind, body, emotion, spirit in holistic nursing.
Mm-hmm.
And it's like, or are they seeking something to satisfy their spirit? And even if it's just that, like that should leave us to be open to it, because we all deserve spirituality. We all deserve that part of ourselves needs to be fed in order to feel whole. And so I was just kind of thinking about, like, even if you're a skeptic, even if it's not like something you totally understand, I feel like even as practitioners who are in that boat, which is not me, but who are in that boat, we could get behind it just on the spirit level.
Mm-hmm.
That people, there's sometimes a spirit level connection to a crystal, there's a spirit level connection to meditation, there's a spirit level connection just to meeting the practitioners who say, I see you and I know, you know, suffering's hard and I'm here to hold space for you. So what are your thoughts on that? Like, you've seen so many people come through
Well, that's,
and had so many conversations. So I'm interested in your perspective. Sorry, I didn't mean to interrupt.
oh yeah, no, you're good. I think all of that, right? Like, I'm like saying, I agree to all of that, and then they may just be coming to our conferences with curiosity, you know,
Mm-hmm.
and I mean, skeptics are invited to attend also,
Yeah.
especially if they're, they just like want to know. I would, I didn't ask you if I could swear in this podcast,
Sure.
but my husband and I, we always tease, he says he has a built-in bullshit meter. Like he'll walk the aisles in the vendor hall and he'll come up to me and be like, oh my gosh, this person had the best vibe. I don't know exactly what it is that they do, but I want you to learn more about that. And he'll
Yeah.
come up to me and be like, do not let this person come back.
Yeah.
Like it's not about like you know, judgment against other people or whatever. It's just that we're in this to help people.
Yeah.
And that's why we started doing the conferences because we felt like people needed to know more options of what was available. I mean, lots of hospitals nowadays they have room for complementary modalities, right? They call them camp.
Right.
And I'm grateful that there are so many hospitals now that offer Reiki even as a pre-op or post-op option for healing because of the research that's been done. I feel like without the research, though, that they probably wouldn't be. So I'm really grateful for organizations that are out there that do have that. I wanted to talk a little bit about some of them, but to go back to your question, just to answer that again, I would say the people who really need to know the science, hey, we have a place for you there too.
Yeah.
The people who are like, show me the research, show me what the heck even is a chakra. You know what I mean?
Yeah. Yeah.
We have places at our conferences for people who are beginners, who are just curious. Maybe they've learned and been certified in a few modalities themselves. There's also business support for people who are curious how to expand their reach and be able to help more people. Maybe now they've been trained in some certifications and they're ready to go. They want to really launch and grow. I mean, there really is something for everyone at our conferences, even if they're just like, I just feel stressed lately and I want to try something new. So
Yeah.
I feel like it's like all like everything, like the whole gamut. You know what I mean? From
Mm-hmm.
here to here, all the way through. And I love that because where else can you go where you can find something like that for everyone? And it's not just energy healing, even though it says energy healing conference, it's really like a giant wellness conference. We just also have
Yeah.
to be really
Right.
open-minded on energy healing, because we've done a lot of research ourselves, and also aligned with different organizations that have that open mind. I don't know if you have heard of the Alliance. Officially, it's called the National Alliance of Energy Practitioners.
Oh, yeah. Uh-huh.
The
I
web,
have heard of
oh, good. The website is called naoep.org. I know we're going to put the bibliography and the different notes in the show notes so
it.
people
Yeah.
can
Yeah.
go and they can like listen in or they can read some of the research for themselves. That one, I love the bibliography. If you go to the tab on that one, you're going to find things from lots of different organizations on Qigong and Reiki. Literally, so many different modalities. They're going to talk to you in there about the heart and the mind coherence,
Uh,
even oncology reports. I mean, there's so many different references. So I definitely, if you're somebody who, okay, you've had your own experience, or maybe you're just really curious and you want to learn and you want to read some of those abstracts, I would say that's a really good place to go as well. Um,
Great.
but yeah, uh, let's see. When you came to the conference, you definitely observed there is a huge, wide variety of people, though, right?
Yeah, absolutely. And I was pleasantly surprised because I was advertising the academy. I was pleasantly surprised at how many nurses came through and how many nurses I spoke with. So there are a lot of healthcare professionals seeking to understand it better. Um, and there were several nurses who had booths for different, types of modalities.
Hmm.
Um, I keep saying I want it to become as mainstream as meditations become, as mainstream as chiropractic work has become. Um, this concept that nurses can bridge this gap. I feel like it's such an important population that can help bridge this gap,
Definitely.
you know? So, I guess this, I usually ask this at the end of my podcast, but I kind of want to ask it now, which is I think a lot of um, what breaks us outside of our box
Hmm.
and pushes us beyond what, you know, we like in life, we're sometimes given these check boxes. Like if you're sick, you go to the doctor, and then, and then, and then we get pushed out of those boxes because that checklist no longer works for us or isn't working for us in that situation.
Hmm.
So I'm just curious, which can also erode trust, in my opinion. Like that's, trust with the medical profession has become lost over time because of this little erosion of we've checked all these boxes and my son's not feeling better or I'm not feeling better or, whatever X is. If you could take all of this wisdom and knowledge that you've gained, is there something you would say to healthcare professionals that would help increase trust again, regain trust so that,
Hmm.
that we can come together and work together? Because that's really important to me.
Yeah. Well, I've never been asked that question before, but I really like it. I'm like, man, this would be a question that you should meditate on. You know what I mean?
Yeah, it's a big question.
It,
So we
it
can always come back to it if you want a minute. But
Well, I would say from my own personal experiences, one
yeah,
of the things would be to um, not just shrug people off. Like if they're telling you something, it's because that's their reality. It may not be showing you that on your protocol or your reports that you're seeing, but that doesn't mean that that's not their reality, what they're experiencing. I mean, and to just shrug something off and say, "Oh, that's pseudoscience. That's not real." It's like, when back in the day, I'll tell you a quick story. I'll come back
okay,
to that, but let me tell you a quick
thanks.
story. This my
Yeah,
brain's like going to this one particular.
okay,
I know a woman. Her name was Effie Chow, and if you look her up in 1969, she was arrested at the ports because she was bringing acupuncture needles from China, and they were like, "What is this?" You know what I mean? And
yeah,
they threw her in jail. And now, fast forward to 2026, she's been gone for a while now. I think she actually passed in 2020. But I interviewed her and I got to hear her own personal story about what she observed, the part that she played in bringing acupuncture to the West. And like not only like brave, willing to take these risks, you know what I mean? To have other people see her in this different light than how they saw other people in the healthcare. But she knew it was going to help people. So she was willing to bring them over, and they were confiscated because, people didn't understand, and they were illegal. It was illegal to bring acupuncture needles to America. And, fast forward, like I said, all this time's gone on, research has been done. Now, people everywhere utilize acupuncture. Well, if you understand
yeah,
what acupuncture is, you're literally like they're putting in this very, very small, minute needle into what is where the energy field is. And what it does is it unblocks the chi in that meridian, and then it allows it to flow again, and then people feel relief, or depending on what it is that they're going for. I've actually had acupuncture for PTSD. It was at one of my conferences. His name's Tim Lee, and he's down in the Cottonwood Heights area. Anyway, he was trying to tell me what it was, and I was like, "Oh, I know what it is. I've like done a lot of research. I just don't. I'm not a big fan of needles." And he's like,
yeah.
"Take a deep breath with me." So I took a deep breath with him, and he placed the needle down in the top of my foot, and it felt like a zing all the way up top of my head. And he's like, "You felt that?" And I'm like, "Yeah." And I'm crying because I don't like needles. And it was so interesting, the relief that I felt afterwards. It was almost like my full soul, not just my body, but it was like my full everything took this big, deep relief breath and sighed. Do you know what I mean?
Yeah.
But I wanted to experience it because of what Effie Chow had explained to me and shared in her whole experience with that.
Wow.
Now I think about her because she was one of the original pioneers when it came to acupuncture, but not just acupuncture. She would lead huge qigong conferences globally. From people would come from all over the world, And I just have so much deep love and respect for her. But now think about it. You can literally find acupuncture in almost probably
Everywhere.
every county. They're like everywhere.
Everywhere.
So depending on the area that you go to, I was up in Montana a few years ago and I noticed there were lots and lots of acupuncture clinics just all over in the area that we were traveling. I've been down to Arizona doing energy healing conferences and it was the same thing. But it's kind of interesting when you come to my area where I reside in northern Utah, there's really not that many. There's a few here and there, or you might find a chiropractor that also has been trained and will offer it, but there's not as many. And so it's so interesting to me. But where it came from, her being a pioneer, being arrested for it, all the way to today was it went through a lot of research, clinical trials, right? Like they had to prove it. And now, in some cases, insurance is even offering acupuncture as an opportunity for people to be able to heal.
Yeah.
So now let me go, having shared that, let me go back to the original question that you were asking, right? Is like, wait, what was the original question again?
I was going to be like, if you can remember the original question, I'm impressed. Um,
I
I
do.
think we were talking about regaining trust.
Okay, so
Um,
so I think that if we just have an open mind as those who are offering wellness, whether it's those in nursing or alternative practitioners,
yeah,
have an open mind and realize that there might be some modalities like acupuncture as an example where it was originally frowned upon, like quite a bit so, and then just realize that maybe we haven't caught up and maybe the research hasn't been done so
yeah,
far, you know.
yeah,
And there's other modalities as well. Reiki is one of them now where I think, oh my goodness, you're literally not even touching them in many cases, you know. You have the option to not touch them.
yeah,
Um, but as nurses, you guys have the license to touch, so you can actually like place your hands on people and the healing that can happen. I went in for
yeah.
surgery in 2021 and I literally asked the anesthesiologist, "Do you know Reiki?" Yep, I was on the hospital, you know, the that they take you out on, you know, into the surgery room. I was like, "Do you know Reiki?" And she's like, "I don't.
Yeah.
Really wish you did. You could do Reiki for me for 5 minutes right now." And she goes, "You know what? Do you know how to do it?" And I said, "I do." She goes, "I'm going to give you 5 minutes." So she was so kind. She gave me five
Wow.
minutes. And luckily, I know Reiki for myself. I was able to just take a few deep breaths, put my hands on, and I'll administer Reiki for myself in that moment.
I love that. I love that that practitioner was present enough to ask you if you knew it. They didn't like freeze up like, in embarrassment or uncomfortableness.
Mm-hmm.
They were so present that they were able to ask you, "Do you know it?" And I'll give you 5 minutes.
Yeah.
I love that.
Yeah, it was sweet. It was really good. But anyway, I would say like not um just brushing people off, helping them to feel validated because just because it doesn't say it in your reports doesn't mean that that's not their reality.
Right.
And there's all these like mystery illnesses, you know, that people now are like, oh, like fibromyalgia. When I was growing up and my mom was like, you know, a woman with these babies and stuff, she was experiencing so much pain, and the doctors would just say, here, and they would throw pain relievers at her. And, you know, now we know that there's so many modalities that actually give people pain relief without the opioids and
Yeah.
narcotics. You know, there's so many different options that people can now do. Even things like massage, you know, can
Yeah.
help
Massage is amazing.
people.
Yeah.
So yeah, I mean, does that kind of sum up your question? That was
Yeah.
a long round.
Yeah. And as you're talking, I'm going to kind of answer my own question because part of my asking the question is for myself.
Hmm.
Um, to because I'm learning just as much by holding this podcast and having the guests I'm having. I am doing my own research. I am doing my kind of asking myself that, like, why have we gotten so far off course that we've lost so much trust that when we do speak from a field of expertise, we are not heard. And I don't feel like we're going to be heard until we do some repair. And so that's why I'm asking the question. But one of the other things that I've noticed in my own practice, when I have clients come in, because I do cranial sacral therapy, so people will come in, let's say vertigo, migraines, are a big thing, some sort of imbalance. And I'm not the expert on those things, but I know my modality can help. But if I have someone who's also doing things in addition to what I can offer and they're seeing progress, I'm like, tell me about it so I can help other people when they come in
Mhm.
and they're suffering from the same thing. And then maybe that short, because my whole philosophy is like, if we can shorten the path to healing, let's do it,
Yeah.
you know? So if I can shorten their path to healing and sometimes I must just a stop along the way, sometimes I'm part of the team, whatever X,
Mhm.
but so I just think why can't we be more open to like asking our patients what has worked for you, and then just making a little mental note so that when somebody else comes in with a similar thing and it's outside of our box, so to speak, the box that we're used to. So like some people might say cranial psychotherapy and someone not about
Yeah.
um, get curious about what cranial psychotherapy is and do some research and who are your good practitioners around you and start creating a referral list, in my opinion.
Yeah. No, I
That would be powerful. Yeah.
yeah. Even just the putting it back like the question, like reframing it, like how can we be heard? Well, start with hearing, you know what I mean? And I don't mean like I'm
Yeah.
not calling anybody out. I'm not pointing any fingers or
Oh
anything,
yeah, yeah.
but I just mean like collectively there's been a lot of people who have gone to the experts and they haven't felt heard.
Yeah.
So yeah,
It's a really good point.
it's I think
Yeah.
it's really good. Mhm.
How can we be heard? Well, you gotta
Here.
listen. You gotta hear. I love that so much. That's a great way to frame it. So in you're trained in, I know you do acupressure, no, excuse me, foot zoning.
Yeah, which is a
You
form of
do
reflex. Hmm.
reflexology.
Hmm.
Okay. And then are you a breath work facilitator at this point?
Yeah. Yeah, I've been doing that
Yeah.
for about 2.5 years. And actually what brought me into breath work was I had a TBI and I couldn't
Oh
drive
yeah.
for about 23 months and
Wow.
severe debilitating panic attacks. And I mean, I was really close to like not doing the energy healing conferences anymore because I was like, man, I've done these modalities and it's not really helping me that much. And I had to regulate my nervous system again. It became so
Yeah.
dysregulated, and you know how important that is, right? Um, so breath work has been one of those things that has helped me along my way to be able to come back, and I'm driving again. I feel clear. Like
Wow.
I'm like doing more conferences now than I have in a long time. We have 7 on the books right now, just for the next like 7 months. So there's a lot of things that's moving, and it's back to normal again, and maybe
Yeah.
more so. But it was the breath work that brought me kind of like back to my center. And when I very first initially started to learn it, I really couldn't do more than just a few minutes because I was just so dysregulated. In fact, my practitioner, the gal that was in my instructor, she asked me to put one hand on my heart and one hand on my abdomen and just breathe. And as observing, not with judgment, but just as an observation, just to see where my breath was mostly. And it wasn't moving my stomach at all. It was only in my chest. And that seems to be a little bit more of a trauma response if you have that shallow breathing. And nothing is happening in my abdomen, no movement whatsoever. It was just all here and it was short and it was just very quick. So the first thing she taught me was proper breathing to slow it down, not have it, not in judgment at all, but simply as an observation. Where is the breath going? Okay, it's right here. Well, let's see if we can send the breath all the way down to the belly. And you know this already. Like I know that you already like are trained in a lot of these different things, but
Yeah.
just as a remembrance for a lot of people to go back to basics, it's like, okay, well, let me go ahead and take a deep breath. And then sending it instead of having your chest move up and down, I mean, it's going to move a little bit, right? But sending that down so that your belly actually expands and fills up and then goes down on the exhale. Just doing that even like 3 times, like, oh, I didn't even know I could do that.
Right?
Right.
It's so funny that and I haven't studied breath work. I've experienced it and and I know some breath um breathing exercises.
Mhm.
So I don't know if you have the answer, by all means share it with me. But I think it's so interesting that when we say the word breath or breathe, or somebody takes a conscious breath around us, we follow suit.
Yeah.
That is wild to me.
Yeah. Yeah, I love it.
Yeah, like even you showing that, I wasn't intentionally, but I could feel my whole body go, you know?
Yeah.
Yeah, like my body wanted to go right there with you because you were talking about breath and breath work, and
Mhm.
so it's just so interesting. I had a, I think I said this my last podcast, but I'm gonna say it again because it's important. My um, nursing instructor would tell us when we were assessing breath sounds to take that time to also breathe.
Awesome.
Yeah,
Yeah.
to you know,
I think it's a really good way to avoid burnout, just to even have a conscious,
breathe.
simple breath. I mean, it seems like, okay, yeah, like really, is it going to make that
Yeah,
big a difference? But it does.
it does. Yeah,
It really does.
totally agree. Um, so while we're on the topic, do you have some favorite breath work exercises that are helpful?
Oh, yeah. Let me show you one that you can do in 2 minutes. And you can
Okay.
teach this to kids. Like my grandkids will do this even. Like it's so simple, but it's so, so powerful. It's my favorite one, to be honest. So
Okay.
it's called alternate nostril breathing. So if you look it up like on YouTube or anything, there's going to be lots of different ways that people will instruct on how to do this breath. So don't just take it for from my perspective. Feel free to like look at how other people are doing it also. But
Okay.
it's simple. You just put one hand over your nostril and then breathe all the way in and then all the way out and then switch. And again, have your belly expanding as the breath is going in and out. And if you do this for even just a couple minutes, 2 minutes, we call this a balancing breath because you go up one side and it is an energizing breath. So if you're feeling really tired, you could do just one side. If you are feeling like maybe a little anxious and you need a calming breath, you could do the other side. But when you do them together, alternating like this, it is a
Yeah,
balancing breath.
I was just gonna ask. Yeah.
So it's really powerful. Even just doing, I mean, it doesn't take that long.
No.
So if you're like, checking reports or getting ready to switch patients or anything like that, you're on the floor, this is something that you could do that would just make such a difference. And it's so simple and easy. And like I said, you could teach this to kids. So you could teach this to patients. It's free. They can do it when they go home, when they're discharged from, the hospital. Whatever type of a nurse you are, I'm sure that you could utilize this some way in your practice to help your clients. And if they're feeling like agitated or if they're in pain, I mean, there's so much research done on breath now. In fact, that's one of the reasons why I was turned on to it. I was like, okay, I am doing. So I was in the opposite situation, right? Some people go to healthcare and they leave the healthcare options to go to the alternative world. But I had done a lot of things in the alternative world, and I found breath because somebody was at my conference, but then I looked it up because I'm like, I don't know what she's talking about. So I looked it up on the Mayo Clinic. I looked it up on WebMD, PubMed, a bunch of different places on, okay, what happens when you breathe. I was turned on to Wim Hof, who is the older gentleman from Denmark that was like running around in his underwear doing marathons like in Arctic conditions. They were injecting life threatening illnesses into him, and he was using breath to literally clear himself of it. I mean, there's just so many different things that it can do. And I'm like, well, I'm sure that this could help me with this, like, anxiety situation. Because I know I'm not the type of person to there's a way that people say it, but I can't remember. It's like you have an aversion to medications, like
Uh-huh.
they don't work for you. And so
Yeah.
I was like, I've got to try a natural way, right? So the breath was like an answer to the solution that I was looking for. And it couldn't have come at a better time because I mean, I didn't want to die, but I really was having a hard time with wanting to live. So I was kind of having this, I mean, 23 months of no driving, it was rough. You know what I mean?
Oh, yeah.
Bottom is a great way to put that. Uh,
Yeah.
it wasn't just that I couldn't drive. I was just
Right.
really having a hard time. 4 or 5 really extreme panic attacks a day at that point. And starting out with simple breaths like this alternate nostril breathing made a difference. And an energetic component, if you want to add some energetics to it, would be to take your middle finger because of the way that the polarity runs in the fingertips. And you place it on your third eye. So it's right between the eyebrows, above the eyebrows, right there. And you just alternate back and forth between the ring finger on one nostril and then the thumb on the other. So you just, as you're taking in the breath all the way in, all the way out, and then switch. And so you're actually having your middle finger right there on that placement. So you can do it that way too. Sometimes you don't have the luxury of doing that, right? I mean, if you're driving down the road, you don't want to be like,
Yeah.
or if you're with clients or patients, you know what I mean?
Yeah.
But typically you can usually do this. You know what I mean? Just like back and forth a little bit.
Yeah.
Another breathwork technique that I really, really love is just nostril breathing only. So that sounds kind of funny, like, well, yeah, that's just normal breathing, but there's a little bit more behind it when you put the intention there. So you close your mouth and you just go deep breathing in through the nose. And I like to add a little bit of a mental visualization for myself that as I'm breathing in the vibration or the energy or the motion of what I'm wanting more of. So it's like maybe a high stress area, or I've just had a long day, right? And I'm driving home. I'll close my mouth and I'll breathe in that energy. So it's adding that intention. I'm breathing in peace and calm. And as I'm exhaling out, I'm letting go of any of that stress or whatever it was that you felt that day that you're ready to let go of. And as you're breathing it out, I mean, I don't like picture myself like a dragon necessarily, like there's fire coming out of my nose, but I do like to picture that it's just leaving and then dissipating and letting go. It's like a beautiful release. But if you think about the way that things are in nature, the ocean ebbs and flows and goes back and forth. And the seasons, like think about the trees. The trees teach us so much, right? In the fall, they just simply let go and they release. And I feel like Mother Earth, in a way, like she does know how to recycle things. Think about the water cycle and the way that the plants just reinvigorate. Like I just love seeing stuff like that. So I think of the breath as a form of just a natural cycle. Breathing in and you're breathing out. You breathe in what you want, you let go of anything else, right? But that nasal breathing, as you're breathing that in, sometimes it can make you feel a little dizzy or lightheaded if you do it too much or too fast. So I like to encourage people to do that slower, deeper for about 3 to 5 seconds as it's going in. And you don't have to like be like, you know, stressed about like timing it or anything like that. Just let it go naturally. And if you feel lightheaded, go a little bit slower. It's okay. You can kind of play with it to see what feels best for you in that moment. But there's so many things. I feel like it's one of those deep relaxation and stress relieving ways. I myself personally, I like to do a really good 2 hour breathwork session now, at least every 2 weeks.
Wow.
So, I mean,
That's
2 hours.
intense.
It is.
Yeah. I've done
It's amazing.
like a 45-minute to an hour one, and that's intense. So, and when I say intense, it's just there's a lot of breathing during that time.
Oh yeah.
But it's interesting. I did do a breathwork class, and it's interesting. I know this is not exactly, we didn't want to get too far into this, but like I had a really good relaxing experience, and it almost felt like I was just in a container. And probably what a lot of people feel like when they meditate, that's how I felt when I did breath work. Like I was in a container and I just didn't feel like there was a surrounding environment. Like it was just me. And I was just felt so, give me my blanket and I will stay here for a long time. I had a friend who had like contortions,
Hmm.
um, and some sort of a somatic response to it.
Mhm.
Um, and she was like, that was unexpected, and I think that's kind of one of the things. That's why you want to try it. And that's why I think it's really important for us as practitioners, as we become option givers, as we're being encouraged to do breath work, like do it for yourself first so you know
Oh, yeah.
how to help people understand what to expect. Like I would have never have known that contortion or just like, that somatic part of it. I knew somatic release was possible, but that was not the intent of that class.
Mhm.
So she was just having like a real like muscle reaction to, and I don't know if there's a term for that, but to the experience. Do you know if there's a term for that?
It was her arms, and she was feeling like a muscle restriction.
Yeah,
The scientific term is called tetany.
tetany. Yeah,
And I've heard from some people different perspectives on why that happens during the breath.
yeah.
So I'll give you two that are probably the most
Okay,
common. One of them is that like your hands, your arms are like an extension of your heart chakras. Think about it. When you're putting your arms around someone, you're literally like wrapping your heart chakra around them, you know?
yeah,
So maybe that was just during the release. Other people have said, well, when you're doing an oxygenation that's flooding your cells like that, the pH will actually, the alkalining can change so quickly that that's one of the things. So if somebody, I always do informed consent education before I begin a breathwork session myself because I want people to be aware. Could you imagine how alarming that would be if it happened
right,
when you didn't know that could happen?
right.
But I would say it happens maybe out of every 20, maybe
Okay,
25 people. So it's not like I don't judge if my breath work session was good or not if people have an experience
right,
like that because
right,
it's not for everyone and it doesn't mean if it was good or not. You know what I mean? It's
right.
just something
But
that
it's good to know, yeah, that it does happen. And as a practitioner, if you've experienced it or you've been with, like in my case, it was with someone who had experience. I was like, oh, that's interesting.
Mhm.
That's good. And I think that, that's because it was like a 45-minute to an hour session. It wasn't
Mhm.
a 5-minute breathe through your nose
Yeah.
like you just showed.
Mhm.
But part of my bringing this up is I just want practitioners to feel like comfortable exploring
Yeah.
and being curious and getting out there and doing the thing, right?
Yeah. Well, and having someone who's experienced and has had some training is going to be really important because, as you know, there's not any licensures or, Doppel's not
Right.
involved in breathwork, sessions or anything like that. So actually knowing that you trust the person that you go to is really important. When I learned about tetany, I was like kind of scared. I was like, what do you mean? Like, then what happens? Like, I actually had somebody who thought she was having a stroke. So I had to call, I called my instructor and was like, do I call 911 right now? Like, because I want to be a very responsible facilitator. I don't want somebody to have this,
Yeah.
experience. So what I learned in
Love
my
that.
training, for example, is that tetany is somewhat normal. And when they start to experience that, you give them the tools of what to do when that happens. They slow their breathing down and it actually subsides. I would say a minute is usually about the most that it continues. But them knowing like this could happen, if it does happen, this is what you do to not be alarmed. You just continue to breathe. You don't hold your breath, for goodness sakes. You just keep going,
Yeah.
you slow it down, and then it subsides.
Yeah.
And I've read quite a few books about breath work as well as part of my own education, just so I have that in my back pocket,
Yeah.
you know?
Yeah.
And there's one that I really like. It's called Breathe. It's a yellow book by James Nestor. You can probably include that in the show notes too, just so people can have that easy.
Yeah.
Um, there's another one that's called Why Woo Woo Works by David Hawkins. He's a PhD. He's
I love David Hawkins. Yeah.
from Australia. I love his accent. He reads his own books. I don't know. I'm from Utah. I like that because he brings in stories. So he teaches with stories,
Yeah.
but then he also has the data in there. So it kind of like appeases both people, helps them to learn from a different perspective. Some other things that might happen during breath work are like people can become lightheaded or they might even have like pictures or memories from distant like memories and stuff like that come to the forefront of their mind. So giving them tools. And then also, I like to stay in my lane. I let people know I am not a therapist. I am not a doctor. If you do happen to have uh, an episode or something like that previously, you need to make sure that you're working with a therapist.
Mhm.
I'm not a therapist. Do you know what I mean? Um,
Yeah.
and then making sure that they're aware of those kind of things. But typically, what happens when somebody does breath work is it resolves itself in the moment because you are getting to this elevated state of consciousness. I'll give you an example. I recently did a breathwork session where little Tammy, I was like maybe 6 or 7, like it was like I saw myself as a 6 or 7 year old in my mind's eye as I'm breathing, as I'm doing this breathwork session, right? I'm laying on a soft, comfortable mat with a blanket on me. I have noise canceling headsets on. Like I'm in a safe place, right? But this little Tammy comes to me and she just says, "It's okay to be happy." So it wasn't like anything like super traumatic or anything for me. But I cried. I just had tears. Emotions came up for me. It was like she gave me permission to be happy now. And it's
Yeah.
okay for me to feel things. And I don't know if for whatever reason that was for me, but it was life changing.
Right?
So yeah, like all kinds of cool things can happen.
Yeah, that you aren't expecting, and kind of going back to that spirit component,
Yeah.
like you can't predict that that's going to happen, and when it does, it's a very spirit filling, experience that no one can quantify. Nobody can put a quantity on that and what it means to you in terms of your healing
Hmm.
journey. It's a very personal experience for you. So,
And I didn't even know
um,
I needed it.
and you didn't know you needed it. Exactly.
I didn't. And so, like, that's the beautiful thing is like, I don't have to talk about all these traumas that happened to me as a child. I literally was just laying, like I said, on a soft, comfortable mat with a blanket, headsets. I usually do like an eye cover for people. It's optional because I know some people, maybe like that's not their option. So I give people a preference. But it allows you to go inside and then things come up that need to be processed. And a lot of science has come out saying that now they're literally saying that unprocessed emotions can be cleared, processed through breath work. One of my favorite books, I'll tell you, I don't know the name of it, but I've listened to it like 4 times now. It's not the one by James Nestor, it's a different one. Oh my goodness, my phone's about to die.
And we're done.
Oh my goodness, I've read a lot of books recently. Okay, it's called The Language of Breath. It's like a blue book on with some yellow on it if you go to Audible, and it's by
Okay.
Jesse. Expression, looking under the hood. Here we go. Jesse Coomer.
Okay. Jesse Coomer.
Oh man, it's a really good one.
Okay.
And he has like got decades of experience with breath work. I've only been doing it for 2.5 years. It was like the thing I didn't know I needed. Like I said,
Yeah.
when the instructor came to my conferences, I was like, "That's great that you're teaching people how to breathe and stuff." But when she told me that I needed it, I was like I'm alive. See me? I'm breathing. She's like, "No, you're not getting it. Like you're not understanding." So I'm
Yeah.
grateful that she was patient with me to say, let's try to have an experience. Oh, I will tell you, like this is so TMI, but I almost pooped my pants that I did breath work. It was actually at a conference.
Oh, I love it.
My husband was next to me and I was like trying to shake him. I'm like, I gotta get up. And so he's like, what? The headset off. He's like, what are you doing? And I'm like, I gotta go to the bathroom. So he helped me up, like pushed me up, and I'm running down the hall, literally booking it to the toilet.
Oh
I
no.
almost didn't make it, but I did, so that was good. But I'm just letting you know because some people might say that that's like a contraindicator if you have digestive issues. I don't feel like it was a contraindicator. I feel like it was very helpful for me.
Yeah.
I just
Yeah.
didn't expect it. So if you're not
Yeah.
hosting an event with 1,000 people in that moment, I would say try it. Right?
Yeah.
Hard times,
Right?
maybe not.
Hey, that's a intervention that nurses are doing all the time is helping people with constipation. So we can add, breath work to that
Yeah, it was.
because you get to a point where you'll try anything.
Yes, and but
So,
breathwork can help with all kinds of stuff. So yeah,
yeah.
reading books about it and then trying it for yourself, I think is really important. I know this podcast goes out to viewers and listeners everywhere, but
Yeah.
I do like to do breathwork all the way from Idaho Falls down to Utah County. So if anyone does want to reach out, I mean, you can just connect with me. I like to charge a little bit less than probably most people just because one of the parts of my mission in what I do with my business is to make things really affordable and
Mm,
accessible based off of not their socioeconomic, but based off of their interest and their desire instead. So,
yeah. Well, I would recommend a couple things. I'd recommend if you're a nurse, and you're in an area that the Energy Healing Conference is, to go in person and just experience it, even just from an observer,
mhm.
like even if you're not being a vendor.
Yeah,
And then if you're not, you can experience it online, right? You have some online options
yeah,
for distance learning.
hmm
Um,
sure.
and then again, experiencing the breathwork facilitation with Tammy and getting that hands-on in-person experience is critical so that you can see where it fits into your everyday practice, right?
Yeah.
So is it energyhealingconference.com?
Yeah, that's our website and it's changing all the time because we're adding in new events and all different kinds of opportunities. And there are some things that you can do online, but I recommend doing them in
Doing
person.
in person.
Yeah.
Well, now, and that brings me to number two option, which is if you're a nurse and you're looking to get out there and promote yourself in your own healing modality, CAM modality, these conferences are great for promoting that and supporting what Tammy's doing, and being part of a community. So
Yeah, thank you.
you have lots of options
Yeah.
to explore or to also educate if you're the nurse who's already learned and ready to get out there and do more.
Yeah,
So
and if you ever want like more information about where research can be found, there are so many organizations that have really reliable information for you. I already talked about the Alliance earlier, but there's another one that's called ASAP.
uh-huh.
And I went to one of their conferences in Baltimore with my husband a few years ago, and I really do recommend it. I would say that probably the majority of the people that were at that conference were actually mental health therapists or licensed social workers. But it was very well done, and you have to have lots of letters behind your name in order to be approved as a speaker for their organization. But it stands for Association for Comprehensive Energy Psychology. I know that there were nurses also at their conference as well. So if that's really important to you, I mean, you don't have to go to my conference. There's lots of different options available nowadays. There's symposiums that are only taught by scientists. I like to have them there at my conferences, but that's not what I limit it to only. We like to also have people who just have, real life experience that are sharing as well. So,
Yeah.
but I want to make sure you guys know that there are different options out there. Another thing about the ASEP organization is that they do fund a lot of research. Um, and it's great because there's different modalities that they do, but it's a worldwide, it's a global philanthropy organization too. They reach out to Warsaw areas and do healing for people in those locations. I've been really impressed with just everything that I've seen from them and just the way that they've reached out on a global. I mean, I met people from Germany there, you know what I mean? It was just like people from
Yeah.
all over the place. It wasn't just a United States thing. Their website is energypsych.org in case you're curious
Okay.
about that one. I mean, there's lots of different things that are out there. So if maybe you have
Yeah.
an aversion to what I'm doing, don't stop there. Go check other things out. There's so much, you know what I mean?
Yeah. Well, and I'll add a couple. There's the NCCIH, which is the National Center for Complementary and Integrative Health.
Mm-hmm.
And then there's the American Nurses, or the American Holistic Nurse Association,
Yep.
are other good
Yep.
resources as well. So those are, yeah, put them all together and you've got some amazing options. So,
Absolutely.
well, Tammy, we could talk forever, I think.
Really good. We've talked for a long time before, but I want to say thank you for letting me come on today. I'm grateful for the opportunity because I think once people understand like how I came into this, just like as
Yeah,
a mom that wanted to help people know about their other options, but not as like somebody who's angry against healthcare. Like, no,
right.
I'm not. I just wanted us to be able to all work together. I kind of feel like being a bridge has been
Yes,
my mantra for a long
I love that.
time, so I'm really thankful. And I've had many scientists and healthcare providers at our conferences. And so I'm grateful and I'm looking forward to having even more in the future.
Yay. Well, I love that. Thank you for sharing your heart, your soul, your passion, and your healing journey. If you want to learn more about what we're doing at the Holistic Nurse Academy, you can go to holisticnurseacademy.org. We have talked about today, believe it or not, we were talking about Reiki, but we just finished filming our Reiki for Nurses course, so I'm super excited about that. Yay!
Um,
And we've got some other courses coming up for contact hours, continuing nursing education hours. So we will keep you posted. So you want to like, follow, and subscribe so that you know that those things are coming. And we just want to thank you, nurses, for all you do in the world to make lives better, people better, and first and foremost, don't forget to take care of yourself. And we will talk to you next time. Thanks so much.
Thanks,
Bye, Tammy.
Hi.